Most people think breast cancer announces itself loudly. A lump, pain, something obvious. But that belief is one of the most dangerous myths in modern health. Because breast cancer doesn't usually scream, it whispers. And by the time it shouts, it's often too late. What makes this disease so lethal isn't just biology. It's ignorance, it's dismissal, and it's that quiet habit of explaining away early warning signs as nothing. Today, we're going to talk about the early signs of breast cancer most people ignore, not to scare you, but to sharpen your awareness. Because awareness is not paranoia. It is power, and that power saves lives. Let's begin with the sign almost everyone misunderstands. First, a lump that doesn't hurt. Pain is not required for danger. In fact, most cancerous breast lumps are painless in the early stages. They might feel firm, sometimes immovable, or have an irregular shape. But because they don't hurt, they get dismissed. People tell themselves, it's probably just hormonal, it's part of my cycle, or it'll go away on its own. Sometimes it does, but sometimes it doesn't. And here is the uncomfortable truth. Waiting to see if something disappears is one of the most common reasons breast cancer is diagnosed late. Remember, pain is not a reliable signal. Change is. The second sign is breast skin that looks different. Not damaged, not injured, just different. This could be slight dimpling, a texture like an orange peel, or subtle puckering. These changes don't usually hurt, bleed, or scream emergency, so they're often ignored. But skin changes can indicate that cancer cells are affecting the lymphatic drainage beneath the surface long before a lump even becomes obvious. Your skin is not just decorative. It's diagnostic. If it changes without a clear explanation, it deserves attention. Third, let's talk about nipple changes people often feel too awkward to mention. Let's be honest, many people ignore nipple changes simply because they feel embarrassed. But embarrassment has never protected anyone's health. Early warning signs include a nipple inversion that wasn't there before, persistent redness or scaling, crusting or thickening of the skin, or spontaneous discharge that's not related to breastfeeding. What's especially concerning? Clear or bloody discharge. Now, not all discharge is dangerous, but unexplained discharge is never something to just shrug off. Your body communicates in signals. Ignoring them doesn't make you mature. It makes you vulnerable. The fourth sign is a quiet change in breast size or shape. One breast slowly becoming larger, heavier, or more swollen. Not overnight, not dramatically, but gradually. Because the change is so slow, the brain adapts to it. And this adaptation can be deadly. Asymmetry that develops later in life, especially when it's paired with a feeling of tightness or heaviness, can signal inflammation or tumor growth underneath. Your reflection is data. Don't dismiss it. Fifth is a persistent breast or chest discomfort that isn't a sharp pain. Early breast cancer pain is rarely dramatic. It's often a dull ache, a sense of pressure, or a strange fullness. It's a discomfort that doesn't quite match your cycle. And because it's so vague, it gets brushed off. But chronic discomfort without a clear explanation deserves investigation. Health problems don't always announce themselves with agony. They often arrive as persistence. Number 6 is swelling in the armpit or collarbone area. This is one of the most ignored warning signs of all. It's not in the breast itself, but nearby. Swollen lymph nodes under the arm or near the collarbone can indicate that cancer cells are traveling through the lymphatic system. These swellings are often painless. They might even seem to come and go. So people assume it's a minor infection, a reaction to something, or just nothing serious. But your lymph nodes are surveillance centers. When they change, something has triggered them. The 7th sign is redness or warmth without an infection. A rare but aggressive form called inflammatory breast cancer often doesn't present with a lump at all. Instead, it shows up as redness, warmth, thickened skin, and rapid swelling. Because it mimics an infection, it's frequently misdiagnosed. Antibiotics are given, and precious time is lost. If redness and swelling don't improve quickly with treatment, further evaluation is absolutely critical. Speed matters here. Number 8. Fatigue that doesn't match your lifestyle. Let's be clear, fatigue has many causes. But we're talking about deep, unexplained fatigue, especially when it's combined with other subtle changes. This should not be normalized. Cancer alters your metabolism. It drains your energy silently. The danger isn't feeling tired. The danger is explaining it away without asking why. Next up, a dangerous excuse. I'm too young. Breast cancer does not require permission from age. Yes, the risk does increase over time. But younger individuals are often diagnosed later because their symptoms are dismissed by themselves, and sometimes even by professionals. The assumption that youth equals safety delays action, and biology doesn't care about our assumptions. And the final one, another false shield. I have no family history. The reality is, most people diagnosed with breast cancer do not have a strong family history. Genetics matter, of course, but lifestyle, environment, and random mutations matter too. Using family history as a reason to ignore symptoms is a mistake that costs lives. Risk is not destiny. A denial is dangerous. So why are all these signs so easily ignored? Because as humans, we are excellent at rationalization. We're taught not to overreact, not to be dramatic, not to assume the worst. But there's a huge difference between calm awareness and silent avoidance. Early detection isn't about fear. It's about respect for reality. So, what does smart awareness actually look like? It doesn't mean panicking. It doesn't mean obsessing over every little thing. It means knowing what's normal for your body, noticing changes without judgment, and acting early rather than apologizing later. Self-checks are not a replacement for medical screening, but they are a powerful early warning system. Consistency always beats perfection. Here's the hard truth about delay. Breast cancer caught early has a dramatically higher survival rate. But the window for early detection is often closed not by a lack of access, but by hesitation, by waiting, by minimizing, by hoping. And hope is not a strategy. Awareness is. This isn't about spreading fear. It's about taking responsibility. To yourself, to your family, to your future. Health isn't something you deal with later. Later is where consequences live. Listening to your body is not weakness. It's intelligence. Your body speaks quietly at first. The question is not whether it will send signals. It always does. The question is whether you will listen before that silence becomes irreversible. If this video opened your eyes even slightly, please share it with someone who might need to hear it. Awareness spreads faster than disease, and it saves lives when it does. Stay sharp and stay aware. Thanks for watching.